Hello, and welcome to yet another episode of IPN TV. I'm your host, Shaina Salim, and today I have the distinct pleasure of speaking with Dr. Gulshan Harjee. Dr. Harjee is a practicing clinician. She's the president and CEO of First Medical Care Incorporated. She is also the co-founder of the Clarkston Community Health Center in Atlanta. Dr. Harjee, thank you so much for being with us today.
Oh, it's an absolute pleasure to be here. Thank you for inviting me.
Certainly. Dr. Harjee, you've had a phenomenal journey from Tanzania to the United States. You are a very well-known philanthropist in the Atlanta community. I would like for our viewers to know your journey, how you started off, where you went to school, what made you do the community work that you're doing today, and tell us a little bit about your professional career as well.
Well, Shaina, I was very fortunate to have the parents I had, and I grew up in Tanzania. If you're familiar with Tanzania, I was born in Dar es Salaam, and then we moved to Moshi, which is at the foots of Mount Kilimanjaro. I was a year old, and then I went to high school at Tabora Girls' School. And during the time when Idi Amin was expelling Asians, that style and fear came south to us in Tanzania, and many of us were moving out of Tanzania. At that point, my father made a decision to send me out to Pakistan. Mm-hmm. And so I was only 16, the firstborn in a Muslim family, and I went to Pakistan, and I was very, very fortunate to be admitted to the Karachi Grammar School. Okay. If you know about the schools in Karachi, I went to the Karachi Grammar School, and then would have gone to the Dow Medical, but because of the war between India and Pakistan, I then went to Iran, went to college, and then had a scholarship from the Queen, Farah Diba, and then the Pahlavis were in exile, so that's when I came to the United States. This was during the Iranian embargo and when Mr. Jimmy Carter was in the White House. So that's in a nutshell my history.
So in terms of, when did you decide to pursue medicine as a career choice?
Well, I was about 6, and my parents said that I declared I was going to be a doctor. And the incident mentioned to me was that my grandmother was very, very ill, and we lived in a village, and a village meaning a true village of 500 people.
Wow.
And it was a sisal estate, and my father was an accountant on this estate. And we were perhaps 2 hours away from reality or a city where there would be a hospital. And my grandmother almost died in the car, and that's when I decided that I was going to be a physician, and I was not going to, under any circumstances, let my grandma die. So that was the story.
That's the story. Yeah, and you've done a lot of philanthropic work pertaining to the field of medicine. So you've taken your career and you've turned it into an opportunity to serve the community. I also believe that you're being recognized by one of the foundations in Atlanta. Tell us a little bit about that recognition, and tell us about the work that you do with the Clarkston Community Health Center.
Well, Shaina, I often wonder if I should have done this Clarkston Community Health Center much earlier, but there is always a plan, and the Lord has a plan for you, and I think that's what happened. Actually, the Clarkston Community Health Center is a 501c. Mm-hmm. The way we came about was with Dr. Said Rais, a good friend of mine who is a pharmacist, and he came up to my office one day and he said, "Gulshan, how about us starting a free clinic?" And I said, "Wow, this is something that I've been wanting to do also." And so that's essentially a 2-minute decision. That we decided that was the thing to do. And that had always been on my mind because of, several reasons. One is that we've had, due to the war and instability in several areas of the world right now, and the massive immigration that we've seen throughout the world, we saw several of the refugees coming into the state of Georgia. And Clarkston is actually a favorite hub for new immigrants.
Is it because of the accessibility to amenities?
Well, there are many reasons. One is because culturally it has just become that. There is housing is appropriate. just the environment. And it has just been a very inviting city as such. It's a small place. It's about 1.5 square miles, and there are 60 plus languages spoken in that area.
That's phenomenal.
And so that is about 5 miles from my private clinic, the First Medical Care Inc. And so Saeed and I, started to think about it, and it has been a journey, let me tell you. It took us almost 2 years to establish a board and to get our 501c, to find a perfect location. And so it has been truly a journey, and we've enjoyed it thoroughly. It has become very successful. What we are is we are not a business. We are not a money-making project at all. We are based on an interfaith board. So on our board are 13 individuals. They are all from different faiths. And so we draw from a different areas of society that they help us fundraise. And these are leaders in Atlanta who believe in the mantra that we are all for service here. And that's how we all have the similar mindset. We are all on the same mission, and our chemistry is amazing. We serve the immigrant community. Refugees, when they come to the United States, they get about 8 months of Medicaid. And after that, unless they are gainfully full-time employed, they will not have health insurance. So just because you don't have health insurance doesn't mean you're not sick, you're not going to need a doctor. And our institution functions on volunteers. That is not a paid person. We are all 100% volunteers. So that's how we operate.
And I have had the distinct opportunity to visit the clinic, and it's phenomenal the kind of work that you guys are doing. And I believe you also started a dental practice, expanded the practice to now cover, dentists as well. So
we appreciate your interest and bringing the ARA into this formula and equation that allowed us to establish the dental clinic. And yes, the dental clinic is also free of charge. The only thing we ask is for a minimal donation, voluntary if able, for some lab work and some for dental medications and supplies. But otherwise, we also have a free pharmacy, and we have psychiatrists that see the patients on Saturdays at no charge. So we are now comprehensive.
So internal medicine and dental, and now and mental health as well.
And free prescriptions.
Free prescriptions. I think that's basically, I believe it's a blessing to have such a clinic and such wonderful leaders in our community. So I'm sure, every family that has utilized the services of this clinic thanks you and your team for doing so. Dr. Harjee, I asked this question to all of the leaders that we interview on this program. We all grew up with a lot of values. There are values that are ingrained in us through our families, through the families that we marry into, through our friends, our colleagues, and people that we meet along the journey of life. Tell us about the values that you have upheld and held close to yourself, and those that have helped you in doing such wonderful work for the community.
Well, Shaina, if I may share something very personal with you. My grandmother, my paternal grandmother, was widowed at about age 32. My grandfather is said to have died of tuberculosis. My dad was 3 years old, and she was expecting my uncle. And they grew up in a hut, literally a cardboard hut with grass as their roof. And it was my dad's dream to be a physician. My grandmother would tell us that if they had peanuts and chai for supper, that was a good day for them. She used to cure tobacco and roll cigars and sell them on the streets of Dar es Salaam. So, my dad had a dream that he would educate us, and by the grace of Allah, I'm a physician, my brother is a physician in Vancouver, and my sister is a nurse. And so all of us went into healthcare. And my dad always said that look at where we were, and the Lord has been extremely gracious to us, and we should always look at what other people need. We've always been raised to share in whatever we have. And so what I do is essentially an extrapolation of what I do for my living, is to care and share. And we've been told that if you save one life, you've saved humanity.
True.
And the opposite of what.
True.
That if you kill one person, you've killed humanity. So we've grown up with those values, and that's what I carry very close to my heart.
Okay. What do you think would be the biggest challenge that you faced, and tell us how you've overcome a
challenge in my personal life,
or the work that you're doing?
I think people can have big dreams, and it's always good to follow your dreams, but what I was always faced with was challenges of being able to settle down in one place. There was so much going on in the world. I was always shifting because of the instability of the world, in which I had no control. But also funding. When you're going to school and you want to pursue higher education, not everybody has the funds that they need to pursue their higher education. And I think that was something that I did experience, big, small, but I did experience that. And that is to say that I moved from Tanzania, and it was essentially a refugee at each point in my life. And so I also feel very close to students who want to pursue higher education. They need funding, and for that reason I established 2 scholarships, which we have helped high schoolers who are going to college and want to pursue a career in healthcare. And the other is an endowment at Morehouse School of Medicine.
Okay.
So those are the challenges. It's always, financial.
Yeah, and it's amazing to hear you not just talk about your challenges, but you've taken that and kind of found a solution for those newer students who may be either refugees or even students who are who were born and brought up here, but you've kind of helped them out with the challenges you face so that they don't face those challenges as they pursue careers in these lines. Well, to kind of conclude this, what would be the one piece of advice you would leave with our viewers?
Well, one thing I've always, as I've said, is that we should not disconnect ourselves from society. We live in a bubble here, okay? We live in one world, and nothing of what we achieve goes with us. No matter what it is, whether it's our education, whether it is our wealth, or whatever, our children, we are trustees of what we have. And so I've always been a firm believer that you should be sharing and caring for people around you. And that's essentially how my life is. That's how I live, and I teach my children the same thing.
Well, this was such a pleasure, and it's such a humbling experience to speak with somebody who's had so many life experiences that are worth learning from, and somebody who's not just achieved so much in her life, but also decided to give back to the community. Thank you so much for being with us, Dr. Harjee.
Thank you.
And thank you, all of you, for joining us for IPN TV's Leadership Series. We've had a phenomenal conversation with Dr. Harjee. The information about the Clarkston Community Health Center, the website, and the ways to donate will be provided in the description box of this YouTube video. For more information on IPN TV, subscribe to our YouTube channel and follow us on YouTube and LinkedIn. Thank you again for joining us.